Hi, my name is Anorexia Horton, and my group and I decided to do anorexia nervosa. And this video is directed towards mostly young high schoolers, for example, grades 9 and 10. To start off, anorexia nervosa implies a loss of appetite, and then it more accurately describes the behavior itself. It stems from an intense fear of gaining weight and/or becoming obese. And then anorexia affects more and more people each year. And next, we have some statistics.
Hi, my name is Mia, and I'm here to talk about the statistics of anorexia nervosa. To be diagnosed with anorexia, an individual experiences the fear of weight gain or practices behaviors to prevent weight gain at least 75% of the days in the last 3 months. People with anorexia have low bone mass, evident in 90% of adult women with anorexia nervosa, and osteoporosis is evident in at least one site of the 40% of adult women with anorexia nervosa. Among all psychiatric diseases, anorexia nervosa has the highest mortality rate, and about 3% of the people with anorexia nervosa eventually die from the diseases from suicide, heat alignment, and infections. Anorexia and bulimia most often affect females. About 40% of the people with binge eating disorders are male. And up next are the symptoms.
Hi, my name is Emily Brewer, and I'm going to be talking about the symptoms of anorexia. This includes low body temperature, bruising, low metabolic rate, and cold intolerance, hair loss, fainting and fatigue, loss of heart tissue, lanugo, little subcutaneous fat, loss of menstrual periods, low bone mass, muscle tears and stress fractures, iron deficiency, anemia, blood potassium imbalance, irregular heart rate, dental decay, constipation, sleep disturbances, immune dysfunction, and infertility. Next, we'll be talking about signs.
My name is Madison Cunningham, and I'll be talking about the signs of anorexia nervosa. It'll typically start off with being told you have way too much or you've been gaining weight, or it could be started with trying to lose too much weight. Signs are stress, breakups, abusive experiences, extreme dieting, being held to a higher standard, and having to look a certain way. Up next, we have treatments.
Hi, my name is Brittany Smith, and I'm going to be talking about the treatments for anorexia. Some treatments for anorexia can be medication, psychotherapy, family therapy, and nutrition counseling. It can be difficult for a person to accept they have anorexia, and it can be hard to engage them in treatment because their resistance to eating is hard to break. The goal of treatments are to restore body weight to have healthy level, to treat emotional problems including low self-esteem or depression, to address disordered thinking, and to help the patient develop behavioral changes that will persist in long term. People with anorexia need considerable reassurance during the refeeding process because of uncomfortable and unfamiliar effects such as bloating, increased body heat, and increased body fat. Treatments tend to be long-term, and the support from family and friends is crucial to successful and long-lasting outcomes. So up next, we're going to do a Q&A with some players off of the CSUP women's lacrosse team. True or false, the number of cases for anorexia that are reported each year are increasing.
True.
Correct.
So what is the difference between bulimia and anorexia?
Bulimia involves purging, and anorexia is when you just don't eat.
Correct.
Who does anorexia affect the most? Men or women?
Men.
It's actually women.
What is anorexia?
It's an eating disorder where people do not want to gain weight.
True.